thanks for the presentation, and now we'll move on to part two, the Q&A or the deep dives. So the plan is if you're the HealthTab system with these testing units are at my local Shoppers, I'm diabetic or pre-diabetic, I go in there once a week or twice a week. They take a little blood sample, they run it through the analyzer, and then it updates to my doctor. They get that data, or I just get it, or do I have to pay for it when I go into Shoppers, or is that just one of their sort of value-added services? So when I'm there, I also buy my aspirin and a jug of milk or whatever. How does that whole
how does all that work?
Yeah.
So there's kind of a lot in there, but I think I'll try to succinctly describe it. So we generally recommend that the patient doesn't pay for the test. We think that model is the least successful of models. But it is really up to the location partner, because remember, we're a solutions provider that we provide them everything that they need to do this type of testing and screening and science-based approach in terms of these services, rather. It's called cognitive services. But patient pay sometimes makes sense, and we often recommend that it be wrapped into a broader basket of services if it can, or be treated kind of like a loss leader, because it's not terribly, HealthTab to the pharmacy is not overly expensive. So it can be absorbed into, like, as you mentioned, that like maybe it drives other sales. We know that it drives prescriptions. We know that it's great for stickiness and keeping that patient more loyal to that service level that they're receiving at that particular pharmacy. So those are a bunch of different models, but we also that's why the raster model exists as well, where we think that there is ample resources and desire and market need for sponsorship of the network to sponsor the cost of the test for the patient for broader reasons, right? So the drug manufacturers, maybe it's patient acquisition, maybe it's for clinical trial, maybe it's for research purposes, but they have already expressed, I can tell you, there's a great desire out there for this platform, and those conversations are going extremely well. So yeah, we generally would like to see the test free. However, if it is charged to the patient, it's not terribly expensive. It really will depend on the test, and depends on sort of the margins that the location partner is looking for. But again, we think that HealthTab is about facilitating other revenues within the broader basket of services that a pharmacy can offer, and that they can, for example, just a good example would be provincial, like they call it MSP here in BC, but I'm assuming some of the people that are watching us from outside of British Columbia, the medical service plan in your province actually provides funding for pharmacists to do certain consultations. So they're able to do things like med checks and med reviews, which can be a really great profit center for them. And so by having this testing, they're able to facilitate more of that type of consultation work.
All right, so back to, okay, that makes a lot of sense. Going to the patient journey, so I'm pre-diabetic or diabetic, I go into the Shoppers, and then once every couple weeks or so, I take my insulin tests before my meals and whatever, a couple times daily, but then I get a more fulsome test every couple of weeks or every month, and I go in to Shoppers, and then they take my samples, and in my electronic file it tracks, and then maybe I can see the graph of, oh, here my blood sugar levels going up and down, and I can sort of see if I'm going in the right direction or not.
Yeah, absolutely. So, the diabetes program that Shoppers is utilizing us for, that's kind of, it's targeted two ways. A, they want to identify more people that they think, based on the patient's health profiles that they already have, that they might be pre-diabetic or diabetic and underserved. So they will flag within their system, and if those individuals are on their mailing list, they'll reach out to those people and say, hey, listen, you should come in and receive this extra screening and support services with your local pharmacist. And then once that patient is properly identified as either pre-diabetic or even diabetic. Actually, the first time HealthTab was ever used was an on-site employer screening program, and they found 2 undiagnosed diabetics on that job site. So it's really common. And for those not familiar, diabetes is like the gateway disease is the phrase I was looking for. Is the gateway disease of just about everything. Your risk for heart attack and stroke and even chronic kidney disease and the rest of it is magnified several times over. So they really want to make sure that that disease is managed because in order to stave off the more acute impacts later on. So first is identification, and then later is management. Some people will be good at managing it themselves, and they'll be pretty good about testing regularly and watching what they eat, and others aren't. Both my parents have passed away already, and I would say that they would be a good example of that. They had illnesses and just did not take the steps, and it was frustrating. And I think it's a frustration for a lot of healthcare professionals where they see someone that they need the tools that make sense for them to get them through a journey where they can better manage the outcomes of their disease. So having them come in for routine testing, showing them their success as they go through changes, but also in an evidence-based way, looking at, rather than like I'm sure we've all had this experience, is like, it's sort of like throwing spaghetti at the wall. Like they bombard you with drugs, and the physician gives you a prescription, and it's like, well, how do you feel? Well, you know what I mean? Like, it's not really like a measured outcome. Whereas we believe that the future of medicine needs to be about measured outcomes, monitoring, as they always say in business too, is you can't improve what you don't measure. And so what we must do is measure those results, engage the person with information, and help them see over time that they're doing well. But also, if a medication is causing an adverse drug reaction in the liver, which is very common, that's caught early, and that if a person's organ functions in a certain area are put at risk, don't just keep going down the path and adjust either the medication or adjust the dosage, and be smarter about the way that we're utilizing these therapies, which is another big advantage to HealthTab.
All right. You had a bunch of big news this week. Started off with the news with Abbott. You've got a distribution agreement with Abbott. What does that? It's a little vague. What does that mean? You've got a distribution agreement with Abbott.
Well, yeah, it's really unique. We're the first company to be a health data company to achieve a distribution agreement with them. This was a journey to accomplish, and I think that it's a testament to the technology and our approach and what we've been able to do, that we were able to secure this relationship. But essentially what it means is that Abbott is, in like most large multinationals, is not super thrilled about other people representing its products. It generally does it itself, right? And they do distribution agreements from time to time, but like if they do it, it's like with like a Cardinal Health or a McKesson or like a large player in the space. But it was really unique, and there was the conversations we had throughout this journey was quite amazing about how many people had to get involved with it. But it was very, very unique for them to be able to sign this agreement with us. But it allows us to represent their products and resell their products. And so we now are focused on the Afinion, where there's other devices that we will add. One that is focused on that will add some liver and kidney functionality in terms of testing. And of course, we've already integrated the ID now, and this is these are now starting to become available pretty much. Public procurement ate up all the allotment, as you can imagine, over the last little while. So, this is slowly becoming available now, and we're working towards that. And so we're really excited to be able to offer this. It was a Herculean effort to get this done. I think, maybe some people get it, others don't. But what it means is that we've now got this partnership with what we think is the best player in this space, the most dedicated player to point of care testing in the human health space. And they share our belief in community pharmacy, where I would think it would be important for people to understand that point of care that's typically existed within the pharmacy is the devices utilized are nowhere near the level of sophistication or capability of what we're able to offer with products like the Affinia and others. The Affinia and others are devices that were typically found in a clinic or in rural hospitals or maybe in other remote medical settings. They're essentially laboratory grade devices that are lower volume than you would, like if you went to a big lab, it does like hundreds of samples at a time or whatever. These do one sample at a time, but they are based on the same principles in terms of the analysis. So much higher quality result, not typically found in pharmacy. These are almost never found in pharmacy. And with the added capability of having them networked over multiple locations, this has, and the ability to obviously analyze results and share those results with all the key players is a major breakthrough. So we're really proud of the partnership with Abbott, and we're excited to see where this grows with them.
And so let's say with the Shoppers agreement that you did, so does that mean like when you kind of roll this out with Shoppers, you've got the initial 20 or 22 locations with Shoppers, and hopefully it rolls out across Canada. Then when a unit, you roll it out into one of the Shoppers stores, they buy one of the Abbott, or they lease or whatever, contract in one of the Abbott devices, that would be then a sale that you act as a distributor, or
so
what does it mean when you represent Abbott? Like, are you going to resell the products or just sell it as part of your kind of solution?
Yeah, we sell it, but it's offered as a part of our solution. So when a pharmacy signs up to HealthTab, what they're paying is a monthly payment, and what they get is the analyzer, and they get the digital solution. And so their monthly analyzer and digital solution costs plus consumables. Because every time you take a test, there's the thing that pricks your finger and the little tubes and all the rest of it. So there's a few things that are one-time use in there. So yeah. Our revenues are generated currently off the monthly lease payments, so to speak, of having HealthTab in store, and the consumables. And then, as I mentioned before, as the network grows, and we're already, deeply involved in sponsorship discussions, there's that added layer of revenue of the sponsored revenues and the specific data-driven programs.
Okay, so a pharmacy gives you X dollars per month to have one of these systems in. It comes with your back-end cloud system where you capture and distribute the data, and then. Who are you taking the cost of the machine on your balance sheet and leasing it, or is it going through a leasing program, or does Abbott sort of rent out the units through you? How does that kind of work?
Yeah, in these early stages, we would put the capital acquisition of the instruments on our own balance sheet and utilize our own funds to do that. However, we do have financing mechanisms that as we grow, we anticipate that to be able to keep that off our books, and it'll be a finance mechanism where the capital acquisition is done on that side, and then obviously it's repaid over time. The payback, depending on the device, can be about 18 months to 24 months on an instrument on that piece. However, it's dwarfed again by when you get into the sponsorship side of the revenues and the clinical trial side of revenues and all that piece of it. There's really no capital expenditure on our side. It's pretty much just like a SaaS revenue almost, if you want to think of it that way. So really high margin revenue. So that's what we're building towards. But the nice thing is that we're able to be profitable as we grow the network, and once it gets to a certain level of machines, and we're pushing towards achieving that level by mid-year next year. And then beyond that, once the network is, of course, that size, the attractiveness for sponsorship is quite large.
Ballpark, can you roughly, what does it cost a pharmacy to have the system installed on a, I don't know, monthly basis? And then like there's that cost, and then every test you do costs a few dollars more or something. Can you, I presume details are proprietary, but can you give us some kind of ballpark range?
Yeah, the ballpark range, it depends on the device or how many devices that they have on site. Remember that HealthTab isn't, once you have HealthTab from an IT perspective in a store, you can hook up a bunch of analyzers to it, right? You can have a whole bunch of them. But right now it'll range from about anywhere from about $300 to $500 a month for an analyzer and the suite on a 2-year commitment. For the location. The test panels, they range in cost. They can, be, I think, $15 to $20. It kind of range for the most part, or sometimes more than that. But I don't have them all memorized. But in that ballpark.
Yeah.
But yeah, they range, and then of course, then there's other little consumable pieces that, again, not huge margins put on those types of things, but it's revenue.
Gotcha. And talking more specifically about shoppers, you've announced an initial rollout with 22 locations in Ontario and the Affinion 2 analyzers. What does it take to roll it out? Like, how long is it? Like, I presume there's a bunch of training they have to do with the pharmacists and the pharmacy help staff. And just, you got to set up a little area. You need some square footage, which is very valuable within the pharmacies. How is that whole rollout? What's the timeline and sort of steps to go through that?
Yeah, so for the shoppers pilot, what they're doing is they're adding in another 11 stores on top of about approximately 10 stores that we had just had secured agreements with as we were in the pioneering days of HealthTab here. We're sort of heading into a new season of the company, but we had secured some really forward-thinking pharmacists in the Toronto area that had added HealthTab to their service offering, which caught the attention of corporate, which we're really excited about. And this is the big next leap forward. So this will be the first time we're deploying the Affinion. So it's focused on the Affinion. And so the way that looks is that training has already begun in earnest. We have an online training portal that we've launched, which we're really proud of. We used what we think a very sophisticated program to standardize the testing and to make sure that people have the online resources that they need to do that. Shoppers Drug Mart themselves, they also have internal training. They have a university, so to speak, where they are constantly training their folks, and so we will eventually the work is being done to get us included in that. So we're very excited about that. Stores are all as of next week, we'll start receiving the instruments, and we will be testing this month. We're very happy to have gotten to this point. It's difficult to underscore the amount of work that has been done over the last 6 or 8 months with our CTO, Roger Seckham, and the IT team over there, and the technical services team. It's a Herculean effort to have the trust and support of a company of this level, Abbott included, that they believe in our digital solution. Of course, there's a lot of concerns and initial mind's eye put on data security and the level of the sophistication of our system. But we're really proud that our system stands the test, and we've really led the way. And I think that they've even learned stuff from us around this stuff. So we're really excited by that, and had their level of trust, because I don't think a digital product not owned by them has ever had this sort of level of support and deep integration into their network. And then on sort of where we're going with this, of course, is they are trying to understand the business model for themselves, and how this workflow works into their own patient journey, and how they can successfully market this to patients, which is a point I wanted to hit, because something that we've really been excited about this is that it's going to be the first time that HealthTab has been actively marketed by a really great marketing partner like Shoppers Drug Mart. So Shoppers Drug Mart themselves are going to be putting the resources behind an active advertising campaign for this service, and for HealthTab we'll have visibility in store as well as online, and they will be utilizing for the first time some of their own internal marketing mechanisms to their existing patient base, which is huge, because we've up until this point been really reliant on the ingenuity and the word of mouth of the independent pharmacist, the one that's willing to take that extra step with the patient and say, hey, here's a service that I can provide, and here's something I can do for you. But now this is the first time that HealthTab in this way is going to be actively marketed, and we're really excited about it. So we're very confident that patients are going to respond positively to this. We know from experience already that the patient journey works, and it's now just a matter of proving this out and then preparing ourselves for scale.
All right. So the store. So you already 11 stores or 10 stores you said have in Shoppers.
Yeah, they have the original systems, the Piccolo.
Okay, and that's part of the 22, so they're rolling it out into another 11 stores. And then those not old stores, they're getting the Affinion 2 as well. They already have it with the Piccolo, and now they're getting this new they
will eventually. They will eventually, yeah. But the 11 target stores is the idea right now is to start there. Obviously, other provinces are targeted for this. The idea is to see how this works in multiple jurisdictions. But we're going to start with those stores and get them operational and observe how the integration process works and installation. A lot of this is about, as much as we can. I often describe it as the best way. For Christmas, my wife got me one of those Sonos speakers. Gift for the family, really, but I was really impressed by the experience that you get this fairly sophisticated piece of technology. You plug it in, you connect it to the Wi-Fi, and it's using your phone to listen to the tune itself by pinging a sound out of the room. And I use that example because it's kind of how we're trying to get HealthTab installation into the stores. It's really very turnkey, very easy. You plug in, you do the training modules online. You have obviously the training resources. You can pull down quick cheat sheets and things like that at any time. But we want to make this as easy as possible to integrate into the stores, and as turnkey as possible is a kind of a key phrase.
Around what, will it take a couple months, or will it take a month to get these systems into the 20, the fully rolled out into the 22 stores, or how many weeks or months away is it from sort of being live?
The first few systems will start to go out as early as next week, and so they're sort of installing them two at a time. And so I would suspect we're all things considered, we're hoping to be fully operational by the end of this month.
Oh, okay. All right. And then so by the end of June, and then in July, maybe they'll work out some bugs, and then maybe July, August, they start doing active marketing to try to promote it and sort of see how to get it.
It'll all kind of coincide pretty close into that time. And we've as part of our service, and another if you're, I'm sure you've used MailChimp, but another service that I sometimes analogize our model to, in terms of from the store experience, is MailChimp a little bit, because if those of you who have ever used it, is that it sends out mass emails and allows you to use it as a contact manager in that way. But they're pretty sophisticated, though. They provide you everything you need. They don't run your program, but they provide you everything that you need. And so we're doing the same thing for pharmacy. So we've learned quite a bit about how to market HealthTab, and we're proud to have a team, I think, that is quite sophisticated at the marketing and communication side of the product side. So we've developed a really fantastic ad campaign that is being adopted by shoppers. So they'll do the dissemination of it, but I think we've come up with a really fantastic looking campaign. It's gonna, I think, be really well received. We provide them, again, the training, and then of course we provide them the full turnkey solution on how to be able to actually provide these services. Our long-term vision is, having clinical practice advisement in others integrated into their company as a part of guiding our location partners on this journey as to how best to utilize the system. And of course, they're responsible for using it. It's their universe to utilize the solution. But we are working very hard to make sure that we don't leave too much to chance in terms of success. Like we're making sure that we're utilizing our experience on the marketing side through to best practices of training, advising them. Even currently, we advise them a great deal on the clinical practice approaches and the sectors that they should focus on, like, for example, diabetes, that we think has the best business case. So, it's quite involved with the relationship between us and the location partners.
And with, let's say, the advertising, do you have like co-op advertising, or is the promotion of that all in sort of shoppers' hands? Like it sounds like you've created some creative and content for them to leverage, or do you have to buy ads in the flyers and web ads or whatever?
No, we don't pay for that. We do the content creation, and so it's sort of co-branded. So when you see that, it'll have HealthTab and Shoppers Drug Mart. It's take your HealthTab is here, and so it's sort of co-branded. It's in that way. It's what it looks like. So there'll be signage in store, and obviously literature in store, and as I say, online ads and other internal marketing.
Gotcha. It's still early stage. You signed up and worked with some smaller pharmacy groups in Ontario, and you've had these independent shopper store that you've been working with for a while. Can you give us any sense of like what kind of revenues, like by year end, you'll be kind of running at? You said it's a SaaS model, so it's sort of your monthly recurring revenues, or like, can you give us any perspectives this year, or when you mentioned, I think next year, halfway through next year, I think you said break even. Can you just talk a little bit about sort of where you feel comfortable with some financial projections, or just general guidance so we know what to expect? Like,
obviously we you and I were talking about this a little bit, and maybe before we started, like, trying to do business in 2020 and 2021 with having some of the constantly shifting sands, particularly this year, right? It seems like almost every week over the last 6 months that some, profound change is gone on. So it's been very, very difficult to stay on a track in that regard, particularly because, our customer is at the forefront of vaccine delivery, right? So this has obviously been a big impact. And so now that this is starting to normalize and starting to level out, obviously we have a big push of vaccination from now until the fall. So we think that, with some of the smaller and independent groups, we see the full rollouts with them later this year. We don't know how fast things will scale per se with the Shoppers Drug Mart opportunities. We stand here today as we're launching the first stores, and I'm hesitant to start throwing darts at the wall and predict things are going to happen on a particular calendar day, because if anything over the last 6 months has taught us, if we've learned anything over the last 6 months, is that if you wait 5 minutes, the weather will change, and you're not entirely sure. What we do know, though, in terms of revenues, we're going to be as we've targeted the revenues that we have in our investor deck that you can see on our website now, if you can pull that down, we will start to be on track with that, but we think by Q2 next year, and that's sort of in a general statement, because we think that we can start to get up to the store volume that we want to be at. We've set some internal objectives, and but right now what we're trying to get folks to understand is that it's about this year has been about planting the seeds for the big harvests in 2022, 2023, 2024. That's where revenue projections will really start to be fully realized. But right now we're just going to ground, focused on ensuring that particularly the Shoppers Drug Mart project was for the benefit of the audience, by far the biggest player in the sector with almost 1,500 locations in the country. We want to make sure we do this right, and so we're focused on that, and we know that the revenues will be there if we get that part right.
So you mentioned Q2 again. What sort of on sort of a store level basis you expect to be cash flow kind of break even? Is that what you're indicating, or is that when things are going to get a little more kind of material? Sorry, just
I think it would be. I think that's it. Is that I think it's realistic to say by Q2 of next year that we would have been able to get up through some of our scale and accomplish some of our sponsorship opportunities that we've been discussing, and that it will be more material by that point. I just see, we're still in this early stage commercial phase, and I know people love to talk about numbers early on and things like that. It's just we take a conservative approach. We say, listen, let's be real about how things actually occur. We have to start. We have to plant the seeds today, as I say, and we have to securing these agreements is no small feat for a small Canadian innovator in this space. For us to be doing the deals and the partnerships that we've been able to accomplish, it A, takes time, and B, it's critical that we focus on delivery, and we can't rush things. And so, but I am very confident the way that we're tracking and the strong and deep relationship that we have with our partners, the amount of enthusiasm I feel that we get from shoppers at the highest levels is a strong degree of excitement around what we're doing. Do I think that we can scale up with them and start to really realize that in 2022? The answer is yes. So this is what we're going to ground on right now, is from now until the balance of this year is nailing this down and working with our client to make sure that they're successful, and that we optimize the installation, training, and supply chain, that we're able to meet their scale demands, because again, this is quite large, and drive that home and make sure that we're successful.
All right. Would it be, you talked about what, $200 to $400 a month per, depending on the tests, the machines that they're running and so forth, and you've got some consumables at $15, $20, $30 per test or so. Would it be just back of an envelope, $500 to $1,000 a month per location once you're kind of scaled up in terms of revenues? Would that be a fair way to kind of look at it? Obviously not in the next couple weeks or couple months, but down the road.
Right. Yeah. So I mean, you're looking at revenues that are similar to that. So if you're at the baseline, assuming sort of like a, of course, volume on the amount of tests conducted impacts revenues as well.
Yeah, for sure. Yeah.
But so yeah, there's the amount of locations, and then density or value add within that. So yeah, we anticipate on the leasing side, if it's the Affinity 2 alone, it's in the ballpark about $300 a month. It's a lower cost system, but you can do quite high volume of tests because there's a high demand for diabetes screening and management, right?
Yeah.
So if you're assuming in sort of the $500 a month minimum on that, across any number of stores. You can start to quickly see the numbers add up. But we think that that grows exponentially as the sponsorship revenue comes in, and already we've received strong interest from major drug manufacturers and even third-party payers are beginning to look at, say, well, how do we provide extra value to our clients, and in the case of the third-party payers, which if you're your benefits providers with your employer, for example, they're trying to say, well, how do we manage costs? They want to follow the American model, which has been to incentivize patient behavior to reduce acute outcomes, and so we're really excited by that prospect as well.
All right. So what kind of news flow can we sort of, without not obviously asking specifics, but through the, let's say, the remainder of the year, like some raster sort of sponsorship type deals, hopefully your Shoppers sort of pilot gets expanded into other provinces, some new test equipments. What kind of news flow? Is there opportunity into other geographic regions, like going down into the US? Even some of their small regional chains are big compared to what Canada is, or in the UK or Australia or any other parts of the world. What kind of news flow maybe this year and then in coming years, broadly speaking, could you kind of point us towards?
Yeah, I would say in the near term, we're going to be continuing to add instruments. So adding more capability within what we're doing, and associated commercial agreements with those instruments. We certainly are looking at other markets. And so, obviously the United States is something that we would like to break into and continue conversations there. We're optimistic about the UK and EU. We think that there's a strong demand there as well. And we've begun, I think, some pretty fruitful conversations. And then we have other pharmacy groups with both, we expand, obviously. We have the objective and the goal of getting national in as quickly as we can in Canada. We obviously want to see HealthTab available everywhere in Canada, and we continue to work towards that objective. So the news flow will be about milestones achieved, new commercial agreements, new opportunities, new markets. And we're heading into this new season where I'm really excited about, and it's been, this week has been important for me, and I think the team, as we've now gone through this barrier, and that we've been able to achieve these types of relationships with the players that we've been able to announce with this week. And we feel that this has been the first domino in a series that we've set up, and we're really excited to start tipping those over and marching towards those.
All right. We're about an hour into this, so we should probably wrap things up. Are there any points that you want to highlight, or any sort of key points that we haven't hit upon before we wrap this up?
I think the message to folks is that, for those that have been sticking with us and watching us and advocating for us out there, we are eternally grateful, and I really appreciate your support and your belief in us. And it's being a small Canadian company and an innovator. For those not familiar, my background was I used to be the assistant to the Minister of International Trade for British Columbia, so I know how hard it is for small innovators in our nation, as successful as we are, to kind of break out and get that recognition. But I think those who have stuck with us, that evangelize us, are going to be the big winners. I think we continue to be underappreciated, but we're going to work hard to demonstrate just how blue the sky is in front of us, and just how incredible the opportunity is in front of us. And we're hoping more people can see that it's not a matter of if we can be successful, it's a matter of when. And so we're working towards that. We've come through a lot of challenges. I think we've proven that we've got an initiative and a team and a survival instinct. You remember that we were, a penny a year ago, and we were kind of limping along to survive, and like a lot of companies. But since that time, today we're fully funded for what we need in the near term. We have an amazingly dedicated team of the highest quality professionals you can imagine. Where the conversations that we're engaged with and the conversations that you've already seen are with some of the biggest names in the business. And we are not going to be a small player for long. We're very focused on success and delivering that success. And the world has made it challenging for sure. The universe has made it very difficult over the last year and a bit. But if we can get through this and come out stronger, and I joked at the beginning of this year that 2020 was a 10x year for us, and we see no reason why we have many 10x's in front of us, and we're going to deliver. So tell people about us, and keep watching, and know that we are working towards some really terrific outcomes.
All right, Hector, thanks a lot for taking the time to talk with us today. We appreciate it. That was very informative. Have a great day, and we'll talk again soon. Cheers.
Yeah, have a great weekend, everybody. Really appreciate your time. Thank you.